Good morning.
Good morning. I'm eating a snack really quick, so I'm not on camera, but I will be soon, I promise.
You are perfectly all right. We got several people, I think, that are attending, so we're just going to hang out and give everybody a chance to jump on.
Good morning.
Good morning. So let's see here. We have one, two, three, four, five. And we had about 10 people accept and a few tentatives. So looks like people are jumping on. Okay, thanks, Britt. So I think if I'm understanding correctly, you all had some basic training, I think, on StemChart with Christina, I believe.
Some people may have, I'm not sure if everyone did.
Okay.
I think I've done the basic training on it because I think I've used it once before.
Okay.
Maybe, I can't remember.
It's all right.
This is completely new to me.
Okay. I think you'll love it. And one of the things to keep in mind is, we'll go through a lot of different things about using StemChart, but at any time, if there's additional training needs with Christina or, additional thoughts you have and you want to run those by me, I mean, we're not one and done, okay? So, well, while we're waiting for others to jump on, let me just ask you all a couple of questions. So, with StemChart, give me an idea of some of the things you think you're hoping to do with StemChart in your program.
Still real new, but my understanding is there's not a lot of opportunity for our students to actually access medical charts in the facilities where they're doing rotations. And so I think one of the goals is for them to get that experience that's a realistic experience with a chart.
Okay. All right. Now tell me a little bit more about your simulations and how you're using simulations in your program.
Well, we're about to start doing it to a greater extent. Because we're redesigning the curriculum. So this is a really good time for us to have this training. But I think we
Okay.
use simulation to a great extent in as many courses as possible. We're really trying to do a flipped classroom in a lot of courses. And so
Mhm.
the simulation is real important for that.
Mhm.
I think there's simulation in a lot of our definitely term one courses. I know health assessments in the sim lab, and then as they progress through the curriculum, they're even psychiatric health, mental health
Mhm.
nursing uses sim. Of course, the med
Mhm.
surge, of course, the women's health uses sim to a very great extent, is my understanding. I haven't seen it yet, but
Mhm.
there's a lot of simulation emphasis. And again, because the clinical opportunities sounds like are very challenging.
It is. So I'm part of the women's health curriculum, and so at the beginning of the semester, we have a mannequin that actually delivers a baby. So we
Mhm.
handle it that we show them deliveries that way and how to handle some emergency situations.
Okay. All right. Well, I'm going to share my screen and we'll jump in, and I am recording this. So anyone who couldn't join or who run a little bit late, I'll send the recording. They'll be able to catch up. So let me share my screen. And, um, so we're going to, let me see here. Okay. So just a little bit of, well, first of all, I guess since I'm first time meeting you all, I could introduce myself, right? Okay. So I know you've met, I know some of you have met Christina and Jennifer Smith. Of course, Jared being your on the ground person, I think. But we have a team of people to help you feel comfortable and confident using these resources. And my role as the nursing education specialist is to assist you with implementation of your products. Now, SimChart is near and dear to my heart. I've been with Elsevier 10 years, and SimChart came out about 3 years before I came to work for Elsevier, and I actually used it in my program. I remember back in those days, we didn't Elsevier didn't have the support teams like we have now, and so they actually flew us to St. Louis when they still had a big office in St. Louis to do training. So I've been with SimChart for a long time. I really love SimChart. I think it has a lot of opportunity in many different ways. Um, so anyway, that's kind of my spiel on what I've done with SimChart. Now, just a couple of things. Let me kind of explain. I believe most of you should be enrolled in this demo course. I added myself to it so that I would have it on my VOB page too. But most of you should be able to find this course right here on your VOB page. And so that's there. I'm going to stop my video if that's okay. It looks like I don't want to have any slowdown with my internet. So I've said hello. I'm going to stop video for a few minutes just to be sure we don't have any interruptions. All right. So SimChart, you mentioned that you knew you wanted to use it as a source for your students to practice their clinical documentation. So SimChart is composed of 3 parts, okay? There's the My Clinicals, which those are those blank charts that you would use for your faculty, for your students to document their clinical work. And then it also has case studies. So there are several case studies, and we'll go through all of these things, but with the case studies, they come with, instructions, and there are some simple ones that are just good for helping students learn how to navigate StemChart. And then there's some more complicated unfolding ones where students will go through multi-phases and they will have to, make some clinical decisions based on the information that unfolds. And then there are also simulations. Now, one of the things with, I think with you all kind of joining us in a total partnership, not only do you have the opportunity to use SimChart, but you also have the opportunity to use Simulation Learning System. So what's the difference, right? Think about SimChart as Elsevier's Cerna. That's our Epic, that's our platform kind of for EHR. Simulation Learning System is our large collection of simulations. And the patient record in simulations and in case studies is on SimChart or our Epic or Cerna. But in SimChart itself, there are a selection of simulations, and they function just like the simulations in SLS. So, I don't want you to be thinking, well, are we going to be using SLS? Are we going to be using SimChart? I'm not really going to talk about that right now. That's something that, we certainly can talk about later on. But the basics of how you want to use it and what do you want to do with it are the same. So we'll stay with SimChart because you do want to use the blank chart. You don't have that option in Simulation Learning System. So I have navigated to my SimChart, which is actually the one that you all should have in your Evolve account. And I'm just going to, go to Content Home, and we'll start by, I do want to review the instructor resources because there's a lot of good things in here, and I hope to have time to kind of get you to do an activity and go in here and explore some things. So, there's a lot of information here about, getting started and using each of the products. You can create your own content in this product. And one of the things that, or one of the common ways that SimChart is used, and you can let me know if you're planning on doing this too, but a lot of times in Skills Lab, I know that many schools still aren't using an EHR in their Skills Labs. Students will come in, they will do their competency checkoffs, and then you may ask them what they're going to document, or they may document it, on paper. But creating a chart for them to document their skills is also, a good use of SimChart. And then the other thing that I'm seeing a lot of people do is using it to create like a med administration simulation. And we're going to kind of walk through that a little bit if you think that's something you'd like to think about, because, we can make it very realistic with, the provider orders and, the MAR with all the meds on it and all of that kind of stuff. So a lot of that is explained here in the create your own content of the instructor resources. But right now I'm going to jump into I just want to review the Elsevier content. I mentioned that we have unfolding cases in, all topic areas. And then these challenger cases, these are the ones I mentioned that are good, just helping the student learn to navigate an EHR. So, these could be really good for them to practice maybe before they're going to do a case study assignment, or even for you to use in the classroom. And again, we'll talk about that, but you'll see you have all the indices for these here. And then the Challenger ones, you actually have an answer key because again, they're more simple, straightforward, learning how to navigate. Then you have the simulation index, which, we have, I told you, there's a select group of simulations pulled from our large simulation collection and placed here in SimChart. And so there's an index for those too. And I might send you out there to look at those in a little bit. So just kind of keep in mind if we're in our course and we are on Content Home, instructor resources are here. Now, student resources as well. And then the other thing that comes when SimChart comes right out of the box, like this is pretty much, you have SimChart setup. This is where you are going to go to assign either the blank charts for them to do their clinical documentation or for you to create a simulation or assign a simulation or case study. And then once you do that in SimChart setup, by default, they will fall in one of these three folders. Whichever, if it's a blank chart, it goes into my clinicals, if it's case study here, simulation here. So one thing to always keep in mind is these folders must stay intact. You can never change the name and you should never delete them because then once you try to make an assignment, there will be no place for it to go. So just kind of keep that in mind.
Question here, Tammy.
Yes.
How does this interface with Canvas, if at all? And maybe you're going to get to that later.
So right now, we really do not recommend putting this in Canvas. We recommend keeping this out on Evolve. And reason being, it just, with the resources, it functions better here. Yes, it can be, but it's, again, at this point in time, we really don't recommend that. And one of the things, most of the time, the reason, the move for putting things in Canvas, from what I find from most schools is, grades, you want grades to pass back and that kind of thing, which I totally understand. But remember, this is more of a review student charting kind of grading. So it's not really going to pass back anyway. You're still going to have to go in and look at, the student work and that kind of thing. So, but I'm not saying no. Okay. This is something we certainly can talk about with, the rest of your team, but
Everybody else feels, I think students, they'll find any reason to be confused. So I think if they have one landing point, it's easier. But if this is, it's a big, it looks like a big system, lots of data, lots of software. And so, you don't want glitches to occur, especially if it's tied to an assignment or something. So that's why I was asking. So your recommendation is within your course, probably just from day one, you have to tell the students that we're going to be using this simultaneously with your other course materials and just set it up that way.
Yeah, and what you can do is not really deep link it into Canvas, but put a link into Canvas, just like you would a link out to a YouTube video or whatever. So you could always have just a URL link that says SimChart assignment, and then they click on it and it takes them into their SimChart page that would look like this. Okay. And, we can work with Christina and Jennifer and making sure all this stuff takes place if that's the way you want to go. Okay. Good question. All right. So one of the things too that I will bring up is this is kind of the default of the way the SimChart looks. And a lot of times faculty will, usually what happens, and I don't know, it can happen in multiple different ways. A lot of times a cohort will be assigned a STEM chart. So, admit fall 2024 STEM chart course, and then it will follow them through the program. That's one way to do it. There is also certainly the option to each individual course could have their own STEM chart. And you could have a nursing 100 STEM chart, a nursing 200 STEM chart, and so on. When I went in to grab this course and enroll myself, I did notice that you already have like a spring 24 cohort in I think I can't remember who.
I'm sorry, I don't think we have access to this yet.
Okay. All right. I went into when I actually logged in, I went into Amy Howell. That was the and I know she declined this meeting, but that was my initial point of contact as far as the request. So I know it was on her Evolve, but we'll figure all that out. Okay, so let's don't get wrapped up in that. We will make sure you have what you need, whether it's your own course specific or whether it's for the cohort. However, if you are going to use like a one like fall 2024 STEM chart, then oftentimes faculty will want to organize it and have their own folders. Or even if you're using it for Nursing 100, maybe different faculty may want their own STEM chart folder. So it's various ways to organize this, and we can give you step-by-step help on doing that. But I'm just going to briefly show you what is kind of common, and that is creating a folder. So if I come here to this folder, add a folder, and then what is your fundamentals course or your first kind of clinical course that you anticipate you'll be using STEMchart? Is it like what is your fundamentals course number?
I think it's 3028L is what I think it is.
3028L. Okay. And we'll just say fundamentals. And this is totally a demo, so it doesn't matter if we're wrong, it's all right. But I can go ahead and create this folder, and then it shows here, and any assignments that I make when I create them and they fall in these particular folders, I can always just move them up to my specific course folder. So that's why I wanted to just kind of put that in there just to show you. So your first use that you mentioned is we want to do some clinical documentation. So I'm going to go into STEMchart Setup, and remember, this is the place where you go to set up all of your assignments. And then once I'm in here, you'll notice that we have the My Cases tab, and this is where all of the various types of tools within STEMchart are listed here. And then there's the grading tab, but we're talking about clinicals. It's called a My Clinical, and it's the blank chart. And so it defaults there. There's also the Elsevier content, and we'll go into that in just a minute. But if I want to create a chart, let's say that I want to do a week 3 clinical documentation. And then I can go in here and I can put, I don't spell well when somebody's watching me. All right. And then you can put information in here, what is it you want them to document? As a general rule, in the very beginning, oftentimes, faculty will start with having students document maybe their full physical assessment for their patient, or a focused assessment. And, you can do care plans in SimChart. There's just a lot of different things you can do in there. One of the things I do recommend is, when they get started, obviously you want them to have this practice. But if they are, if they're doing well with, a full physical assessment, then maybe sometimes you just have them do a focused assessment. So you can vary that however you want to do it. I'm saying this is in fundamentals and this is week 3. So maybe what I want them to do is document vital signs, basic care, and interventions for safety. Just making it up, but maybe that's what I want them to document this week. And then I can go in, and these competencies are not required that you select these. They do not change at all what the student has to do. The only thing is these can be good for, when you're looking at accreditation and you want to show, how are you using, CUSIN or the client needs categories or whatever. You can always, select some of these competencies. So for this one, I'm going to select safety and informatics because I know those are 2 things that I'm really hitting on, and we'll do patient-centered care. And then I didn't have to add any, but I did. If you have a document that you might want to include with this clinical assignment, maybe there's specific instructions that you've used in the past for what you wanted them to document, or what they were responsible for as far as a concept map or a care plan, or medication information, or anything. Maybe there's an article. Whatever it might be, you can always attach a file here if you wanted to. Don't have to, but you can. And then I'm going to click publish. And I'm going to get this notification. You can enter in your email. This means that whenever your students submit this assignment, you will get a notification by email that they have submitted. I used SimChart before we had this option. So I'm perfectly happy to opt out of this because I can always go into SimChart, the grading feature, and I'll be able to see, did they submit it on time and all that kind of stuff. And I didn't need all those extra emails. And I imagine some of you probably feel the same way. But I am going to say opt out, and then it has been published. You see here, it says week 3 clinical documentation has been published. So this is SimChart setup. I can actually go out of SimChart setup, come back over here to my main SimChart page. It was a My Clinical, so it should be here. If I have to, may have to refresh. And here it is right here, okay? If I want to put it up here in my fundamentals folder, I'm just going to say, move this, and I'm going to put it up here and move. And you can have as many folders, subfolders, you can organize this however you want to. I could have put in here subfolders for clinical instructors if I wanted to. So that's entirely up to you, but I'm gonna go ahead and jump in here. Here's my simulation. So let's view as a student, and let's go in, and we've taken care of our patient, and we're going to do this this documentation. Now, please, guys, if you want to ask a question or you want me to stop, I want you to stop me, okay? Because I'm in this now, and sometimes I miss the chat. So please, if you have questions, stop me, okay?
So far, so good.
Okay. All right. So let's go into this. So I want to jump in here to week 3 clinical documentation. I am viewing as a student, says click to access. And then this kind of information box is going to pop up, going to tell me, this week you're going to be documenting vital signs, basic care, and interventions for safety. It says these are the Houston competencies I'll be kind of addressing. And then I start my assignment. The first thing they have to do is enter in some basic demographic information. Now, it's totally HIPAA compliant. There's, no way that the patient can be identified. So my clinical day is today, and my patient is Marie Harris. I just randomly picked those, but some people will have them put their patient's real initials in. Some people feel even more comfortable letting them make up some initials. That's entirely up to you. Here's the biggest piece right here. Okay, you need to make sure that they're selecting the correct hospital unit. Med-Surg is going to be probably, like in your fundamentals course, one of your most used units. But women's health, if they're taking care of peds, if it's a psych patient, just make sure they select the correct floor. So I'm going to do that. And this is a female, and she is 77 years old. You have the opportunity to put in a month and a day. It doesn't do the year simply because when you create these, the time, I mean, if we put the year in there, these would have to be, the patient will be getting older, right? That's the best way to say it. So we just put the month and the day if you wanted them to include that. And then they select an avatar. And so let me see here. I'm going to do this. And then the provider is John Smith. And then I am the student nurse, and save. And so I did that information. That was all I had to put in. And then once I get here, there is information here, the preclinical manager. So again, I don't know what you would have normally had them do for clinical paperwork. Would you have them look up their patient's diagnosis and, identify the pathophysiology, or have them, discuss what is the therapeutic regimen for this diagnosis, or, what's going on in their, health and like history and physical, what other health problems might they have? If you're having them look up medications, they can always do that in here. And, as they progress through, like this fundamentals one, I'm just focusing on vital signs, basic care, and safety. But as they move through, you may want them to look up meds, or this is a great tool to use for pharmacology for specific conditions in some of your courses. For example, I'm going to use women's health. Not that I'm an expert in women's health, and you're going to know that when I get to talking, but because you mentioned that, one of you mentioned it, I want to kind of focus on that. You're in class, you're teaching, pregnancy, labor, delivery, postpartum, whatnot, and maybe the medications that they need to, learn related to pregnancy, and especially, only things coming to mind is Pitocin, right? But I know
Or
that's more.
iron.
Or iron, yes,
Yeah,
thank
yeah.
you. But you could have them, this could be an activity. They do their reading. I know you already said you're doing a lot of active learning, flipped classrooms, scrambled classrooms, things like that. So, part of their pre-class work was to do their reading. Maybe they're doing some short path lessons. And now as an activity, you could have them go into a blank chart, find the relevant medications for this condition, and enter in information. And the good thing about the blank charts is they can stay open for 120 days. So I have had faculty go in and create this blank my chart, and it would be solely used for the student to enter in the pharmacology that they're learning in that course. Okay, so that's a little bit different than where we started with this, but that is an idea. And if that's something you're going to do, let's just go here and probably, okay. So we don't want all that. We won't. All right.
Oh,
so we
yeah, at the
won't-
bottom. Yeah.
Yep. And notice as soon as I select the med, I get this link right here. This links me out to clinical pharmacology, which is a part of SimChart. Clinical pharmacology is it started as a part of Elsevier's clinical solutions side, which sells products to healthcare facilities, hospitals, and all that. So this is a very common tool used in a lot of places. Now it's available in SimChart. So this makes it very realistic for our students to kind of understand, what does a nurse do when she's in the clinical setting and there's a new med ordered and she's not familiar or he's not familiar with that. They go into whatever their informatics piece is to look it up. So we have clinical pharmacology.
It's
So,
really great. I'm impressed to see this.
okay. So I'm going to just pick, which one should I pick? 300 milligram tablet.
Yeah, that's fine.
Okay. So once I do that, I get all of this information. I can go through and I can look at, indications and dosage. Tells me, what is the oral dose? Here's adult and adolescent pregnant females. That's kind of what we're talking about, right? So we can go in here, we can look at this, how it's applied, description, classification, even, as far as administration, do they, administer before 1 hour before, 2 hours after meals? If GI, irritation occurs, give with meals, adverse reactions, monitoring parameters. So everything they really would need to know about the medication, they can go in here and look it up. And then if you're using this record as something for them to, either enter med information for their clinical patient, or if you're using it for a classroom activity like I suggested, then they would go in and they would fill this out. But this is a wonderful reference for students. Now, I use something really simple with iron. We also know that, they can do IV meds. When they do IV meds, they can actually do compatibility checks and things like that. So this is a great resource. Either way, however you want to use it, classroom activity or for their clinical documentation. But because this assignment, I told my students they just had to do vital signs and basic care. I'm not really going to have them save this information. Okay. But again, you can see they can go through that clinical pharmacology, review all of that information, put in what you would want them to enter into this. Okay. So let me go up here back to my original assignment. So let's go into vital signs. All right, I'm not going to save that right now. So go to vital signs and So, for my patient today, I took care of my patient and she had 144. That was, oral pulse was 88. And that was an apical pulse, respiration 16, and blood pressure was 98 over 70. And this was right arm. She was lying. She sat was 90. And this is the digital probe finger. This is on room air. And notice I could immediately go into pain assessment from here if I wanted to. But again, this is just kind of their first week or third week going. So this is what we want them to do. So they'll save this information. One of the things that, you know, I thought this was going to bring up a clinical alert. So I went a little low, but maybe I didn't quite go low enough. Maybe that 98 is close to 100, but usually I'll put a high blood pressure in. And if you put something that's definitely out of the normal range, I'm not quite sure why that didn't pick up, but a lot of times I'll go in and I'll put 148 over 98 and they'll get a clinical alert that says this blood pressure, whether it's diastolic or systolic, is out of the normal range. Is it okay to continue with documenting? So it gives them a little prompt of, should I look at something else? Should I look at their trends? Is it something I need to notify somebody about? Do I need to look and see what kind of meds they're on? Those kinds of things. So it will do that. Didn't do it for me this go around, but
Why did it pick up the SpO2 of 90?
yeah, it did. It did not pick that up either. And I'm not, I've never really played with that to see if we
Yeah.
get that clinical alert. But I'll show you. Let me show you what I usually do. We'll try something. 158 over 100 and right arm. Fine. And let's go 88. That's pretty low. And let's try saving them. Oh, what did I do? Please. Oh, sorry. Okay. It'll remind you if you don't document everything. Okay. So systolic blood pressure is outside the standard. Diastolic is outside of the standard. Okay. It did not do that. I need to write that note because I think that's something they need to add. I mean, I don't know that they will and go immediately and add that. But one thing about SimChart, I'll tell you, and about this product and the team that worked for this product, when I get suggestions from faculty about things that need to be different, or, like this, for example, I always take this back to the team and they really listen to us. So a lot of times, it may not be that they can go into this complex system and fix that today, but they can certainly put that on their roadmap to make those changes. So I always tell my faculty, if there's something that you feel like this should do that it's not doing, by all means, let me know because we'll certainly take that back. So, okay, I got to document basic care, right? So I'll go into my patient charting. I'm going to go into basic nursing care, and I'm going to document safety. So fall prevention, education to room, bed in low position, call light within reach, bedside table within reach, told her to call for help. And then whatever, if you need them to put in any particular notes, they can put that. If we, it's safety. So there's going to be additional things that the student could document if they needed to. We don't really need to do other than, let's just say here, other, I'm gonna say, mm, 3, 2, or safety check. Whatever, okay? And then, general other things, and then did they agree with it? Do they not agree? Did they understand? She understood. I'm gonna go on into activity, and I can just put she ambulates with a walker. I'm not gonna do a good job because I'm gonna
Don't
show
be
y'all how to
sleeping
check.
while you
check it.
accompanying me. You need to be paying attention to what I'm doing. Because you
Richard,
don't know you need
Richard,
to
we
do.
can hear you. Richard,
Um, hygiene. I'm gonna say bed bath with assistance. I'm not gonna document mouth care. I'm gonna go on. That's all I'm gonna do. I'm gonna save that. I'm not doing a full job or intentionally. And then the other thing that we were supposed to do is interventions. So I can go into system nursing intervention, and then I can come down here to actually, I think probably needed to do that under basic nursing care. And we did to a certain extent with what I put for safety. So I'm going to say this is good enough. All right, I'm done. I did my assignment. I'm going to submit it, and then I can close this. So I have completed my assignment as directed. And now what happens is, now that I have completed my assignment, I'm back as an instructor. Notice I got rid of my view as a student. Come here, and then what I'm going to see is it's going to list your students, and it's going to tell you it's ready for grading. If they forget to hit submit, it'll just say in progress. If you did not want them to submit, but you really just wanted them to save it, and maybe you were going to review it and give them the opportunity this is the first time they've done charting, you're going to give them opportunity to go in and, add some additional stuff. It'll see in progress. If they submitted it and we're not supposed to, you can always reopen it. Okay, but I'm going to go ahead and grade this one so you can see how that's done. And so what happens is it's going to open this specific grading report. You can also navigate all the way through the electronic health record, but what you'll see here is an assignment kind of document that kind of walks through everything. I can see here's what I put in as the objectives. Here's the demographic information. If you had them do any work in preclinical manager where I was looking up the meds or the diagnosis and all that, you would have some information here and you could enter in, their evaluation of that. But I did not have them do preclinical manager. They didn't do a care plan. The only thing they really did was some basic charting. So I can go through here and I can look and I can see activity. They were supposed to do a little more documentation than just this. So I can edit, I can put notes in here. Maybe I want to remind them that need more details, or anything else that I could come in here and say, okay, what about dietary intake? They didn't put that. So, you can enter in notes, whatever you want to. I can come here and I can say, What did you do about this low O2? So you can give them, feedback right here, save it. Okay. And then moving on down, once I'll just kind of close that annotation box. And then what happens is that section, this was the patient charting, I get the opportunity to give them a grade and some comments. Now, I don't know how or if you grade clinical. I know many schools do satisfactory, unsatisfactory, needs improvement, that kind of thing. So I'm just going to go with the needs improvement, and then I'll enter in some information about what they needed to do next time, or if I needed them to come and talk to me or whatever. Okay. Remember, I selected some competencies. So this is where I get to go in here and say, I'm going to say that, we address these competencies. I'm going to say safety, competency not met, additional assessment, and interventions needed. And then depending on what sections they had to actually enter into, like if they had done a care plan, if they had done information preclinical manager, all of the comments that I'd have made in each one of these sections the grades would come here, and then I can give an overall grade. And then of course I could say, I'm going to give them a satisfactory because the clinical performance was good. And I honestly used to use this to give all of my feedback. If they, their communication was good or they needed help with that, if they did any skills, that would go here. Anything that I might have done, I would have entered it, or they might have done, I would enter it here. So save it. And then once you save it, you select post to Dropbox. That doesn't mean it goes to any special Dropbox. That just means that the student will get an email notification that it has been graded, and they will go into, so if I close this out and come back here and I go back to view as a student, what's going to happen is now I'll be able to see that this simulation, I can, if I click into what I think it's going to tell me I've already done it. It'll give me my feedback. Or, I could have just seen that right from, if I go back one, I click too quick. They see, that it's here. So, that's kind of how it'll work for your clinical documentation. Now you can do this same kind of thing for lab and lab skills. Remember I said that these charts can stay open for 120 days. Some programs will actually just go in and create a skills lab chart, and they go into my clinicals every time the student comes to lab each week, whatever skill they're practicing. Health and physical assessment, I see it used a lot because, they come in and, first week, maybe they're just, doing a general interview. Next week, they're doing, cardiovascular or specific systems. And then each week they can re-enter in that same chart and document their practice for that assessment. But you would go through the same process. Okay, so let me stop. Any questions about the My Clinicals?
This really looks great. And I love the pharmacology component because that seems to be a big need for our students. They tell us and we see it.
Mm-hmm.
I was wondering if there are any resources for other courses that don't occur in a hospital setting, like assisted living or community health? Or are these all kind of geared to look like a hospital chart? Like, are there any home health type records or any other outpatient clinic type notes, or they all have the same style?
Unfortunately, at this point, they're all pretty much acute care based. Now, will you all be using Shadow Health? Do you know as part of your solution?
Yes, that will be included in
Uh,
Evolve 360.
Okay, so we have lots of different settings and environments. So, you may have to kind of juggle. This week I'm using SimChart, but maybe then when I'm doing community health or something different, that's not an acute care. The Shadow Health would be good, but that's asked for a lot. And I guess because we do have Shadow Health with such a robust across all environment kind of library, that hasn't been something that's been embarked on with SimChart. So, okay. Now, one thing
I
I
do have a
wanted,
question,
yes.
Tammy. So,
Mhm.
last semester I helped teach, or did the health assessment lab with Amy. And so
Mhm.
that your last comment about it being used weekly, because that's what we did. We set up on the first week their patient.
Mhm.
So every student set up their partner as their own patient, and then every week, like you said, we did a system:
Mhm.
cardiovascular, respiratory, musculoskeletal, things like that. So that's very, very good to be able to do that for that particular class, because I know we had problems last semester with the system that we were using.
Mhm.
So this is very encouraging to be used for that particular class.
Thank
And
you.
is that going to be so uh, when we as the instructors go in, do we assign the specific system for that week, or they just pick that particular system to
They
go into?
probably would just pick it out.
Okay.
I can whip through this real quick. Let me just show you. This is kind of what you would want to do. You would want to go into SimChart setup, create new of a My Clinical. I'm going to call this um, health assessment lab documentation. And then I cannot spell this when you all are watching me. What is the problem? Am I the only person who's like that? Okay. And then here you could say each week document the system assessment covered or learned or whatever. You just put your instructions there and then they'll know each week. And then I'll just publish, opt out, submit. And then the good thing about this is when the student, when they go into this, it's going to be down here. It should be here in My Clinicals. And I don't know if you all did this, but did you go in each week and see where you could provide comments and feedback each week?
Yes, we did.
Okay, good. Yeah, because you can actually, you don't have to go through that full grading like I did with the one that had been submitted. There's a place where you can add a comment. And I always say, put the date, 3/26/24, vital signs assessment, review normals and abnormals if you need to give them some feedback. So that's good. And that process is explained in more detail than what I know I'm going kind of fast. All of these things are explained really well in the instructor resources too. Okay.
Thank you.
All right, thank you. So let me ask another question. So do you anticipate that you would want to use this for like your med administration lab?
I think we could. Potentially.
You definitely could. So I'm going to share with you, let me show you this document right here. And this is, I put a picture of your demo course just to show everybody what it should be, but this is a cheat sheet and I'll send it to you, but I'm gonna walk through it a little bit now. But you know, this is kind of what we kind of identified as a process to be sure that the meds that you want them to administer show up when you're ready for them to administer them. With SimChart, when you're creating your own simulation or your own case study, oftentimes you got to make sure you get the phases right. And that'll make sense when I kind of go into this creation process. So that's what we really did, with this. This is a cheat sheet. You can enter in all of this information. But how would you do that? I go right back to SimChart setup. And this time I'm going to create a simulation. So I'm going to go into simulations, and I'm going to create a new, and then you're going to get to this setup page. And again, usually what I advise faculty to do is call this an advanced skill, because you do have to make sure you're getting your timing right for the meds to show up available to administer in the MAR. So, when you get to the point that you want to create one of these, I always say, please reach out to me. We can walk through this together until you feel more comfortable. But I'm going to go ahead real quick, and let's just say that I'm going to set this up just so you can see. So if I go to setup, and the first thing it's going to tell me to do is, this is going to be med admin lab. This is kind of basic fundamentals, and then I can put in whatever information I want to put, as much or as little. Patient profile, patient, this is, I'm going to go with the med surg floor, automatically gives them a room. If you have your lab set up for specific stations, you could change this if you wanted to. Put a diagnosis in here. I'm going to put pneumonia. And it's really the things with the asterisk that I have to put in there, but I went ahead and entered that. I'm going to say that the patient was admitted on my cheat sheet. I said admitted on Sunday at 08:00. All right. And then, you enter in this if you want to. First name, John, and then Doe, and male, 69. Put in here, I'll go ahead and put this in because I do want them to check the date of birth. Even though we don't have the year, we still can have them check that. And you can choose an avatar or upload a picture. I have had faculty actually upload a photo of their simulated patient that's in the sim lab. I'll just choose an avatar, and let's pick this one, and then I'll save. So if I missed anything, it's going to tell me, but I put all I really had to do in that. Now I can go back to simulation setup. And here is where I'm going to do the timeline. And this is where it can get a little tricky. Patient was admitted, we already said, at 8:00. This is going to be a one-phase simulation. I'm going to say, and on my cheat sheet, I said it starts Monday, and you can put however many minutes. I'm going to say 60 minutes. And Monday morning at 08:00 is when they're taken care of. Now, one thing to keep in mind is the simulation, it's always going to be in simulated time, right? Even in which that's what we already always did, even when we used a paper MAR. they're coming in on a Thursday lab, but we're telling them it's Monday morning at 8 a.m. and you got to give meds. But always remember it is a simulated time. So then I can put information in here. I can put information here. Objectives are faculty only. Students can see the information for the phase. So maybe I want to go in here and put review MAR and administer meds as appropriate. Save and proceed. And then I have to configure some charts. Two that have to be in here are the signatures and authority for admission. And then I'll add my medications. But if I go into here and I say, it's going to be, I'm going to put in, let's put in TP and add that. And you can, these are signatures of anybody who might have taken care of this patient before your students assume care on Monday morning at 8 o'clock. So I'm just going to add one. That's enough. Go back to my timeline. The other required chart that you have to configure is the authority for admission. The good thing about that is you really don't have to do anything but come in here and you put this in here. This was Sunday when they were admitted. I can pick TP and then that you can go through and do all this mess, or you don't have to. Just for time's sake, I'm not doing all that because my objective for this lab is not for them to review all the chart and all the forms. I just want to make sure that they know how to go into the MAR, look at the meds, look them up, and administer them safely. So I go back to my timeline, and then here's where I will add, I actually have to add like a pharmacy order for that particular medication. Or I will add, that will put it on the MAR. So let's go to order entry. Now, provider charts is where you would actually go in and write the order. Now, one of the things I will go ahead and say, I know it doesn't, it's not, it's a little bit dated simply because the system, in this situation, you would go in, they would document, it's Sunday, 0800, or it's 087 by now. And we're going to say, this was, whatever, somebody else, I could have put the provider in there. And then you actually write the orders, like type them in. And I know that at this point, what usually happens is when the provider puts them in the order entry, they automatically will go to lab, a lab or a MAR or whatever. It doesn't work that way in this. But, if you want them to review the orders, you need to write them in here. If you just want them to go straight to the MAR, then you do not have to do that. That's entirely up to you. So I'm just going to enter in some meds because I want you to see what it looks like. So if I go into order entry, pharmacy, and these were ordered on Sunday, and we're going to say lisinopril. We'll do this one. And this is a routine med. It started on Sunday at 0800. End date, you have to put something in there. I just grab a time. This is oral. This is 1 tablet and it's daily. Add the order. Oops, please write a time. It'll remind you if you missed anything. Add order. Okay. 8. I did that. There we go. Okay, so it puts the orders down here. I could go in here and let's add insulin. Let's do 70, 30. And this is routine. We'll put this in here. Was ordered on Sunday at 800. Administration sub Q. Medication dose. Here I can put see instructions or special dose. If I want to put this is what they take at home, then I can put 20 units and 2 times a day before meals. If it's a sliding scale, if you're putting in something for sliding scale, you would document your sliding scale in here, what the instructions were, and then I got to put an end date just because. And then I will add that order. Okay, so these are my meds. Submit the order. Back to the timeline. And now technically I've done everything that I needed to do, unless I wanted to enter in, say, a blood pressure or a blood glucose that I wanted the student to review before they actually administered that lisinopril and administered that insulin. So at that point in time, I could come here, add a chart. I would go into vital signs and I'd put some vital signs in there. Remember, our cheat sheet has some vital signs listed. I could put with vital signs, I could also enter in the blood glucose. So, I can put in as much information as I need, but I'm going to leave it at that for now for time's sake. And then I'm done. I'm going to go back to simulation setup. And now you also have the ability to do barcoding and use your scanners. So I could do this. I'll be able to see, here's my patient's armband, here's the med labels. I can add in some distractor meds if I want to, and get additional labels. Then you print them and then use them, in your simulation. So you can do that. And maybe it wants, it wants me to select. Let's just close. Okay. And I'm going to go ahead and assign it. Now, once I assign it, I can't edit it anymore. So if, there was, if I decided I wanted to add some additional meds after I'd already created it, then there's a process to go into your SimChart setup, make a copy of it, and then do your edits. And again, all of those kinds of things, when you get to the point you want to do that, all you got to do is reach out to me and we can certainly set up a time and kind of walk through some of that stuff one-on-one. But I have assigned it. So now if I go back to my content home, it was a simulation. So this is it. And then once I select it, I can view it as the student will see it. Or I could have previewed it back on the setup page. And then here's what the student's going to see. They're going to see that. Okay, here's their, if they start simulation, yes, they're going to get their instructions, review the MAR, administer meds, continue, and then they'll come in here. They will go into the MAR and these meds. All right, this one, notice this one is, it's a daily med. The daily standard in SimChart is 9 o'clock. It's Monday at 8 o'clock, so I can administer this. Now this one was 0700. Okay, so my my time has passed, you know, what I could have done if I wanted to make sure this one was green, instead of saying 0700, I mean 0800, I could have done, let me see. Well, if I'd have done 0730, that would have been too early for the 9 o'clock meds. So you see what I'm saying? You got to kind of play with the time you want them to assume care so that the meds show up. And in your instructor resources, there's a form called pharmacy time rules. And you know, that'll help you with that. I think what happened is I should have picked a different med, a different insulin maybe or something. But anyway, I could have changed it. You know, I made it, I just selected the 2 times a day. I could have said special dose and put in at 0800 every morning, and then I would have been able to give it. But when the student goes in to administer meds, they click this green button. They would scan the ID band, scan the barcode. If I don't have that right here, then they would see this information. They're administering it it is about 08. What time is it? Because you got to make sure, they have to be sure they're charting in this specific time, right? I couldn't put 0900 because it's not 0900 yet in my chart. It's probably 0802. And then I would put my information in here. Maybe I want to put what the blood pressure was. 128 over 68, my initials, and then save. And then it'll show that the med was given. If I, you know, I should be able to, like, if I want to see what the blood pressure was, if I go over here, I can see, I should be able to see notes. One of these you can actually see. Notice this little icon. It's in the MAR too. So they can go to clinical pharmacology right from the MAR where the meds are. So there's another way to access that. Okay. All right. Moving right along to be cognizant of time. I do want to point out a couple of other things. If you haven't played around in this demo course, go into the demo course and you have a practice assignment for my clinical, a case study, and a simulation. So, you know, if you want to just play around in a chart, I'd say go into this simulation right here. And you can navigate all the different pieces of the chart. It's not something you would save, but it just gives you some information of how to kind of navigate, start simulation, and then you can get into the patient record and you can explore more about what all of these, you know, what's in all of these folders. What I do want to show you is under resources, you have, first of all, you have a link back to that clinical pharmacology right from the resources. And you also have a link to Clinical Key. And Clinical Key is another resource that was part of Elsevier's clinical solution side that's now part of our education side. And so this is amazing. There's a wealth of information and tools here. You actually can look at clinical overviews. There's some clinical skills. You have the clinical skills collection, so you would still probably want to focus on that. But there's other things like drug monographs and evidence-based nursing monographs and all patient education, one of my favorites. You also have, and your students have access to, I think it's about 75 books. And it's not their textbooks, but things like if I want to do, let's do clinical companion. There's a clinical companion for med surg book. There's a clinical companion Thinking maybe there was one for some of the other books, but I know the med-surg books are here. There's some, case studies in here. There's also Mosby's, a lot of different things. Mosby's lab manual. There's Saunders Drug Handbook 2024. So lots of resources there. They also have journals. You and your students have access to all of Elsevier's professional journals, and you can go through and search lots of resources here. So, when that first week 3 clinical assignment that I had them do, maybe part of my assignment was I wanted them to find an article on patient safety. Then I could have them come out here in their clinical key and research, and they have access to all of these journals, full text. Okay, let's talk about the tools within clinical key. So I also have, I want to do these evidence-based nursing monographs, because this can be very helpful for clinical when they get there and their patient had pneumonia. I'm thinking about my patient I put in there. So I can go in here and look at pneumonia risk factors, pneumonia treatment, pneumonia complications. I want to go here, and then I can, I really wanted to kind of filter this to be just the evidence-based monograph. And search. And here they can go in here. So I came to clinical. I didn't drag all of my textbooks. I might have brought a couple things. They probably bought a rolling book bag with all their books first time they go to clinical, I know, but they don't have to. They can use this resource. They can go through, see what the current kind of practice is for treatment, additional information. Here's assessment, planning goes through the nursing process. There's the interventions were, planning and implementation, evidence-based nursing recommendations. So lots of things that they could just gather their information from here. That's another really good tool. I love the patient education. So let's search patient education for pneumonia. And then I could do community acquired pneumonia. Students have the ability to change the language. They can print. This is something that they could print and share with their patients. This is also a wonderful tool for your scrambling and flipping your classroom, right? So you're teaching pneumonia, and your student, you would, in the past, I know what I would have done, before I kind of shifted the way I taught. I would give them, a lecture. We would do PowerPoint slides on, what is the patient education you need to give to your patient before they are discharged, or, you're seeing them in the clinic, or you're seeing them at home health, or wherever it is you're seeing them. You could, instead of putting them on those slides, and it sounds like you're already doing this thing, have them use this resource. They could use this resource and a blank My Clinical that's available for them to use for classroom activities. They could go in, document patient education. They could look this up, document patient education. They could even take it so far as to role play with their learning partner. So really the sky's the limit with what you can do with this resource. Additional things I will mention, there's lab values are here. In addition to having the Mosby's book, we also have this. And I like to show the procedure videos because this is good too, because let me get rid of pneumonia. I just want to go to procedure videos. So procedure videos, I want to see them all. So these are, come on, I know I can. Maybe I've got it. Procedure videos down here. Okay. These are like procedures that their clients may likely have in clinical. It may be that they are, maybe you are in class talking about liver failure, liver disease. You want to show them a little bit about a paracentesis. You can go in here. I like this because I think this is great. If they're, they go to clinical, we don't always know what kind of patient they're going to have or what's going to end up happening with their patient. So here, if they know they get to clinical and they're told that, your patient's going to be having this procedure, they can always go into Clinical Key, kind of look up what is this procedure. They can look up, what kinds of things can I do to help get the patient ready. There's lots of stuff down here. What do I need to do to take care of the patient after they have this procedure? So this is a great tool within Clinical Key. And again, just get in here and explore. And the easiest way to do that, you don't have to make an assignment or anything. You can go right in through your practice assignment. Now, most likely, I don't know if you have it yet, but most likely in your ebook collection, you also, and your students will also, being part of the 360, have access to Clinical Key without having to go into SimChart. So, I'll show you what that looks like just real quick. So, check your ebook library and see if you have access to this. If I go in here and are we set to go to 11:30 or 12? I can't remember.
I believe it's 11:30.
I think so too. So I'm speeding up my talk here. So, all right. You search for Clinical Key for nursing. Clinical Key for nursing. It'll look like this. When it comes up. While I'm waiting for this, are there any specific questions about what we've talked about? We didn't really go into creating assignments for like a case study, but you go through SimChart setup pretty much the same way. Also, in terms of use of case studies, classroom activities is one of the best that I can think of, and I'll send you some best practice ideas in a follow-up. But your Clinical Key for nursing, if you search for it in your ebook, you should see it looks like this, but you have to go down here and click to actually access it, and it'll take you back to where we were with Clinical Key. Okay. And there are additional resources here too. So SimChart is much more than clinical documentation. If there's one thing I want to say, it's much more than clinical documentation. Your classroom activities, you have the ability to do so much with that. And what I'll do is, I'll start. We got 2 minutes, right? Any burning questions or anything additional that you want to kind of think about?
Tammy, so would we be starting this in the fall? Or Brittany?
I think so.
With the
Um,
rollout of Evolve 360, I imagine this will be a component of that rollout. I think we're starting that rollout ideally in the summer, if not the fall. But it'll be for the first semester students and then moving forward.
Okay. All right.
Okay.
I mean, because it looks like a great plan. So
Yes.
kind of excited to get on board with this.
Yes. And again, SimChart is complex. Okay. Obviously. I mean, I spent an hour and a half and could have spent a whole day. So, please know that this is just our initial meeting. I hope that I've piqued your interest enough to think about, okay, I think I want to use it this way. Let me reach out to Tammy and see if she can help me kind of go through that. And then certainly additional like functionality product training, we will definitely, you definitely can have additional times with Christina and, for additional functionality training. So I'll send a follow-up email. I'll include some additional best practice information, kind of revisit the things and highlight the things that we talked about today. Inviting you to please reach back out to me if you need, when you're ready. Because if you're going to roll it out in the summer, we talked a lot right now, but you might be, wanting to wait until, maybe you're not going to have a chance to work on this until, next month or 1st of May, or, if you're going to be there during the summer. Just reach out to me and we can certainly jump on some additional sessions. Okay.
So much.
Thank you. And I hope you all have a great rest of your day and rest of your week.